welcome to our virtual wellness class, which is going to be seated yoga this evening. I'd like to introduce you to Christine Storms. Hi, Christine. Christine.
Thank you so much for having me, and
You're
thank you all for taking your Friday evening to join us for some seated yoga, some good wellness to begin your weekend.
I think it's perfect. I just want to give them a quick who you are. Christine is a certified yoga instructor, and she's the owner of Valley Paddleboards in Connecticut, where she specializes in yoga paddleboarding classes. And at the end of this wellness class, I'll have a slide up for Christine's contact information. So, Christine, welcome.
Excellent. Okay, everybody, we can get started by just finding a comfortable seated position. You can sit back in your chair if it's got good support. We just want to try to sit up nice and tall, lengthen that spine. Take a couple of deep breaths. We'll start with an inhale, nice and slow. And exhale. Another inhale. And as always, follow your own breath. My guided breath is just an offering. Do what works for you. And one more inhale. And on your exhale, I want you to exhale with sound. Don't forget, we can't hear you, so let it out. Don't be shy. Okay, sit up nice and tall. Feel free to close your eyes. Thank yourself for showing up today. Thank your body for being here and allowing you to try something new if this is your first time, or to continue in your practice. And we're going to begin by doing some cat-cows. Most of these are done seated on the floor in a traditional yoga class, but if you're sitting in a chair, they are, seated cat-cows. So on your inhale, you're going to gently raise your chin and arch your spine gently. And on your exhale, round the back. I'm going to turn to the side so you guys can see a better view. So on that inhale, exhale, round the back. Inhale, up. And exhale, round that back. Take about 3 more of these at your own pace. Okay, nice warm up for the body and the spine. Create a little mobility and fluidity. Next up, we're going to raise our toes. So while keeping your hands in a comfortable position, whether that's on the front of your thighs, or if you'd like to hold the chair for support, we're going to lift our toes, grounding all 4 corners of the feet. So just lifting those toes and relaxing the toes. Again, lifting the toes and relaxing the toes. Lift the toes, relax the toes. Once more, lift the toes, relax the toes. Now we'll lift our heels. So on the inhale, lift the heels. Really feel that quadricep engagement. That's the biggest muscle in the body, on the top of your leg there. You might even feel it a little bit in the back of your calf muscles. And drop the heels. Lift the heels, drop the heels. And lift the heels, drop those heels. And once more for me. Lift the heels, drop the heels. 2 nice breaths. Inhale, exhale with sound. Next, we're going to extend our right leg out. Again, engaging the quadricep. Might feel a little shaky, but we want to keep our core tight and sit up tall. And you don't have to lift your leg all the way up, just to your own ability, whether it's a ½ inch off the ground or 6 inches. You're still getting a nice core strengthening workout, a leg workout.
Sorry to interrupt. Is there any way we could see your bottom? There's so much
Oh, sure.
I can't see your legs. I'm so sorry.
No, that's quite all right.
Thank you. That's perfect.
Of course, of course.
Sorry. Thanks.
Is that better?
Yes, thank you.
We'll try that again. We're going to extend that right leg to the best of your ability, whether it's closer to the ground, a little up, or all the way out. And while engaging the core and keeping your back strong, sit up tall and drop the leg. And extend. And gently dropping that leg. And extend. And while you're in leg extension, we're going to point the toes, flex the toes. Point the toes, flex the toe. Point and flex. And gently release that heel down to the floor. We're going to extend the left leg. And drop that left leg. Extend the left leg. And drop. And extend. And point the toe. Flex the toe. Point the toe. Flex the toe. And once more, point the toe. Flex the toe. And gently release that heel to the floor. Next up, we're going to see if we can shimmy to the edge of our seat or edge of the bed or whatever you're using as support. Sit up nice and tall. And just take 3 nice breaths here. Next, I'm going to have us interlace our fingers, wrap it around the front of our knee, very gently bring the knee to the chest, and squeeze on your inhale, and bring it in as much as you can, engaging the core and the seat, sitting tall. If this is not available for you, we can certainly do this sitting back in our chair so we have a little better support for our spine. Same thing, interlace the fingers and just gently pull, reach in, knee to chest. Inhale, pull in. Exhale, release. Once more, inhale and release. Release down to the ground. Left side, interlace the fingers, same thing. Knee to chest. Inhale, knee to chest. Exhale, release. Once more, inhale, knee to chest. And exhale, gently place the heel back to the floor. Now back to our right leg. We're going to try for a figure 4 stretch. This is a great hip opener, a nice gentle stretch. There are modifications, so let me demonstrate the first way, and then I'll show you guys a couple of different options, see if one works best for you. We'll interlace our fingers again around our right knee. Bring that up. Then gently take your left hand and put your foot over your left thigh. It creates a number 4 if you look at it. If this is not available and it just does not work for you, that is quite all right. There are plenty of days when my hips and my knees say, no, thank you. So we can very gently bring our heel to the inside of our left thigh. It can be out here if it's not available. If it's available, bring it in. Otherwise, we will have our right foot on top of our left thigh and very gently place your right hand on your right knee and just very delicately press down, really opening that hip. Nice, slow breaths, really giving nutrition to the muscles, moving any possible stagnation. You can even feel free to give your foot a little massage. Feels really good. A little massage to your calves, all the way up to your thigh and your hip. If you'd like to take this deeper and you're not currently feeling a stretch, there is one option. Left side comes down, hook under your foot and cradle your leg as if you were cradling a baby. And just gently rock. They call this rocking the baby or rocking the leg. And on your exhale, bring it down gently. And we will unfold our number 4, releasing our foot back to the floor. We're going to do the other side. So interlace the fingers. Inhale, bring that knee up. And gently wrap your right hand around your left foot and bring it into a number 4. Gently taking that left hand and pressing down. Again, feeling a nice hip opening. Following your breath. Exhale. Inhale. Exhale. Maybe a little massage for this side, for the foot, the calves, the thigh.
Hi, Christine, it's Kirsten. We have a quick question. Is
Of course.
this suitable for those with EDS hypermobility? And then, I'm sorry, Lauren did answer, yes, anyone can do this.
I saw the typed in question, so I responded, but I know Christy would give the same response. So these exercises are meant for anyone, but if you're feeling any discomfort or it feels like it's too much for your joints, just stop and do what's comfortable for you. It's sort of all of our exercise classes that we offer. Of course, everyone joining us is coming to us with different fitness levels and different physical abilities or disabilities. So we can't 100% guarantee that this is the right thing for everyone. So we always say to people, do what you can. And if you feel any uncomfortableness, stop. Don't push yourself too hard. If you can do this, then by all means, it shouldn't injure you any further. We know that people with EDS have very unstable joints and can injure themselves pretty easily, but this should be okay. So Christy, if you want to add to that, I know Christy's, so just to give everyone a heads up, Christy's my sister, and she's been our unofficial massage therapist and yoga teacher at the Dysautonomia International conference in prior years. So she's worked on a lot of EDS patients too.
Thank you very much. That's a great answer.
Okay.
Like Lauren said, if something is not working for you, just do what works for you.
Right. And I'm sorry, I'm jumping in one more time. Yes, absolutely. I wanted to remind everyone that this will be recorded and uploaded and shared. Earlier up in the chat, you'll see that I included the link for the Vimeo page. And I'll share that again before the end of the class. Thanks, Christine.
Of course, thank you. Okay, So we'll just take that leg, and if you haven't already, unfold to your number 4. My left hip was favoring that stretch today. It felt good. So we'll just reset here. Check your seat, and if you need to move to the edge of your seat or back so you have a little more support for the spine, either one is okay. We just want to sit up nice and tall, long and lean. Take a few inhales and exhales with me. So inhale, exhale with sound. Exhale. One more inhale and exhale. Next, we're going to do a gentle seated twist. This is another movement that by all means, if this is your twist, that is 100% okay. If you'd like to take it deeper, you can follow me. So to begin our twist, we're going to take we'll start with the left side first. Left hand on either around the top of your chair or just on the side, and your right hand gently pressing against your left thigh, and you will twist and look over your left shoulder if that's accessible for you. If you're here, that's great. Here is great too. Couple of nice inhales and exhales here. Really gently wringing out the spine, sending nutrients to those muscles that may have stagnation or feel tight. And on your exhale, gently untwist and put your hands back on your thigh. And we'll do the same thing on our right side. So right hand over to the side of the chair or over the arm if you choose. Left hand on the outside of the right knee or thigh and twist. Inhale and exhale. Inhale, exhale. Once more. Gently untwist yourself, bringing your hands back to the front of your knees or thighs. It's always good for us to pause and reset after we do a movement. Just shrug the shoulders, roll a little bit, gently move the neck if you feel like it needs to be reset. Now we're going to do some shoulder shrugging, shoulders to ears. So on your inhale, I want you to reach those shoulders up to the ears. And exhale, drop them. Same thing again. Inhale, reach up. Exhale, release. Inhale, up. Exhale, release. Once more, inhale, those shoulders up, and exhale. We're going to gently drop our chin to our chest. Take 3 nice, gentle breaths here. 3 nourishing breaths. Inhale, exhale. This gently opens the spaces in between our spine, gives us gentle fluidity and more mobility if needed. And back to center. We'll reset again. I'm going to just reset myself to the edge of my seat, as that works for me. Now we will drop our right ear to our right shoulder first. So inhale, and on the exhale, drop that right ear to right shoulder. And just remember, wherever you land is a beautiful place. Even just a little stretch in the neck is a beautiful thing. And inhale back to center. Once more on the inhale, and on your exhale, drop left ear to left shoulder. One side might feel tighter than the other, and that's okay, just go with it. And when you're ready, bring it back to center. You can close your eyes, take a few breaths here. Thank your body for everything it's done so far, and that we're going to do a few more things and maybe even smile while your eyes are closed. It shows that we are proud of ourselves for showing up and happy with where we are in this moment. Okay, next we're going to try seated warrior 2, also known as Virabhadrasana 2. I'll demonstrate first, or if you have experience with Virabhadrasana warrior 2, feel free to follow along. First, we're going to start with the right side. So I'm going to scoot to the right side of my chair. You guys should be able to get a better view of how I'm sitting. We're going to plant that right foot down, pointing straight to the right. And if it's accessible to you, I'd like you to try to walk out your left leg, almost making a right angle. If this is where your warrior is going to stay today, you will lift your hands and gently gaze over your right hand. If you'd like to go deeper into this warrior 2, feel free to use the chair for stability and helping you get your left leg up. We are going to put that left leg with your foot pointing this way, your right leg right leg and right foot pointing the opposite. Knee always over ankle, never want to overextend because it puts pressure on our joints. And then gently open up our warrior. If you do not feel comfortable standing and you'd like to take that seated warrior, I'll show you that again. You make a right angle with your left and your right, and just open up those arms and gaze over the right hand. Standing warrior. Arms are longer than I thought. Okay. Gaze is over the right hand. Nice inhales. Exhale. One more big inhale. Exhale. Feel free to bring your hands down. Use the chair to help you. We're just going to rotate our feet and bring it back in.
So Christine, real quick, so with the warrior stretch, her shoulder hurts. Is there anything to stretch shoulders gradually?
Sure, instead of just coming right out, like a way to transition?
Yes.
Okay, great. I just wanted to clarify. So I'll just jump into warrior 2 here for a minute. If this doesn't work for you, I would always recommend just coming to heart center if that's okay for you. Heart center is just a very relaxed state. It doesn't require as much extending of the arms if you do have any shoulder or joint issues. So you can do this, or if it also works, you could even just put your hands right on your hip. There's many, many variations. You do what works best for you. I hope that
We
was
try eagle
helpful.
arm.
Yes. Oh, I'm sorry. Someone jumped in and helped us. And I think they said eagle arm. Is that correct?
Eagle arms, yeah.
Oh, they said eagle arms.
Yeah.
Yeah, or do like
Eagle
field
arms.
goal arms.
Eagle arms are also good. That is actually a posture that my body slightly struggles with, but I can show you. You were just bringing, we'll start with the right side. Right arm under left arm, and it's like a little crisscross. I don't know if you guys can see that. I have very, very tight upper back, so I'm not as fluid in this, but that's eagle arms.
Thanks. And another question was, is there a modification to keep the torso low, but get the leg strength more similar to a humble warrior?
That's a good question.
Yeah, that was me, Jamie. Well, I do a fair amount of yoga, but I have trouble sometimes being upright. So like doing something, like, I don't know, a gate pose so you can stay lower, or, with your head down, but your legs doing the pose.
Sure, actually, I suppose we could, if you were sitting, are you sitting in a chair?
I am, yeah.
Excellent, maybe. Let's give this a shot. I'll try first, because that's a wonderful question. You could actually do Virabhadrasana or warrior, any of the warriors, without standing up. If you do have this accessible to you, my chair is a little wide, but you could actually use the chair as support. And if you didn't want to twist, by all means, you could certainly look forward. But I'm actually sitting on my chair, whereas before I was up here and twisting. But if you'd like to just sit, I've actually never done that. It's quite comfortable. Does that help you?
Oh, it's Lauren. I just wanted to ask everyone if we could save the questions to the end and just kind of, Chris can go through the routine. And I know everybody's got ideas and questions and stuff, but I want to make sure we kind of keep you in your flow. I think you're almost done too, right? You've probably just got a few.
Yeah, we actually are up to doing warrior on our left side if you guys would like to join me. So we will face to our left on the chair. Your left foot and left knee will be facing this way. And then you will gently bring that right leg out. We had the two variations if you wanted to just stay right here, like a right angle or the letter L. This is a beautiful warrior, very supported, allows for you to sit up tall, and then either hands to heart center or open warrior, and gaze over your left hand. If that's too much on your neck, by all means, you can bring your gaze forward or your gaze down. And if you'd like to join me in our full warrior, we'll bring our right leg back. Knee always over ankle. Right leg back. Arms up. Or heart center. Inhale and exhale. 2 more inhales and exhale. And when you're ready at your own pace, gently come back to your seat, walking your feet in, resetting on your chair. Place your hands on your thighs. Nice inhale, exhale. We're going to finish with 3 closing breaths. So find your comfortable seat, whether it's on the edge of your chair or further back. And on our inhale, we're going to reach up as tall as we can. place those palms together. Exhale down to heart center. 2 more times. Inhale, reach up as tall as you can, like you're reaching for the stars. Exhale, hands to heart center. And once more with me all together. You may feel your heart beating. You did do some good work today. And just gently bring your breath back to a gentle pace. Honoring the strength and the light in yourself and everything that your body brought to the chair today. I want to thank each and every one of you for sharing your practice with me. And thank you so much, Dysautonomia International, for having me be a part of this. This is just fantastic. Thank you.
Oh,
Namaste.
thank you so much, Christine. We truly, truly appreciate it. I would like to open it up for questions right now. This is a great opportunity. And as Christine is showing you, hydrate. When you're done, hydrate, hydrate, hydrate. It's very important with any form of exercise, no matter how strenuous it is, that everyone continues to hydrate. So does anyone have any, lots of thank yous coming through, Christine. So
Oh, thank you guys.
one question, any good places to learn standing? Any good places to learn, but not bending or chair yoga?
We've had some other exercise classes. Well, Chrissy can answer. There's tons of free yoga videos on the internet. I'm sure she has some good tips.
Oh, I would absolutely look up. I can't think of the girl's name. I'll have to share it, and maybe Dysautonomia, they can share it with you. But if you're looking to learn standing postures, I would look up standing or balancing postures, and typically they're all about staying long, so there's really not a ton of bending or going from floor to top so quickly. That's more vinyasa based, but yeah, just check out some balancing poses. Tree pose, mountain pose, those are all beautifully grounding but strengthening poses.
Great. Thank you. Are there any good positions or stretches for a neck that is already hypermobile? And yes.
I'm gonna, if Chrissy doesn't mind, I want to answer. I actually know Corey. Hi, Corey. I think that's knowing that people with EDS and Chiari malformation and cervical instability could be joining us. There's a lot of different types of neck problems we might have. I think it's probably best to speak to like your physical therapist or your doctor about that, because we definitely don't want to give advice if you already have a pretty serious, neck issue. I know I don't even have EDS, and I have some cervical issues that I can't do certain stretches. So I think, sometimes strengthening is actually just as important as the stretching. So somebody had asked Chrissy earlier about the dog. They were trying to guess if it was a cat or a dog because Dora was curled up in the corner. So Chrissy is a very cool yoga loving dog.
That's Dora. She is a 5-year-old lab hound mix. She's currently laying on the other side of the room, but she loves doing yoga, and she's my my trainer.
Yeah. Someone had asked, please give meditation also. So actually one of our guests joining us who's participated in Chrissy's class is Beth, who will be giving a meditation class, three actually in a row, in the coming weeks in June. So definitely tune in. We're trying to do these virtual wellness classes once a week and keep them free and accessible to everyone, record them so that patients who couldn't tune in live will be able to check them out later on social media or on our Autonomic Disorders Vimeo library, Autonomic Disorders video library, which you can find on Vimeo, vimeo.com/dysautonomia. If you know someone who is a professional, like a wellness professional who does this for a living and has training, and might want to volunteer to teach a virtual wellness class in the future, we would love to connect with them. So feel free to introduce them to anybody at Dysautonomia International. And this is Christine's information. She's up in the Connecticut area. And if you ever are in the Farmington River Valley, I highly suggest paddleboarding yoga with my outdoor loving nature sister. This is how I get rid of my Dysautonomia International stress. I go paddleboarding with Chrissy.
So because I am sharing my screen, I can't see any more questions. So Lauren, if you could take a quick look at the questions to make sure we've captured everyone.
Oh yes, let's see. Wow, someone said, this is the first exercise for me in 4 years. I made it through with minimal alterations. Thank you so much. So Sharon, I'm seriously clapping for you because I know how hard that is. And I think a lot of people here do. I was bedridden for 2 years with dysautonomia, and I'm sure other people on this chat have gone through periods of that too. So it's super, super hard to start exercising again, but be very proud of yourself for doing that. So let's see. Meditation.
That's a warrior. That's the definition.
Yeah, you earned the warrior award for for this class. Tight muscles in shoulders and neck. I have EDS, but my neck is fused. I need to stretch, but I'm limited. Anybody with like neck fusion stuff, I really think we have to be careful and just suggest that you should probably talk to your doctor, because we don't want to mess up your already compromised neck. You know, that definitely makes things a lot harder. There are physical therapists who have special expertise in Ehlers-Danlos syndrome. I think the EDS Society probably has some recommendations for that. There are books available. If you have a PT who maybe doesn't really know about EDS, but wants to help you and is willing to learn, there's some books that are available to help them kind of learn more about it so that they can safely instruct you on special exercises. Are all other exercise classes on Vimeo? Yes, we slowly get them on there. We record it and then we do a little editing, and then like a week or two later, we get it posted to Vimeo. Are there warm-up poses that someone could do to help them work towards doing all of the poses? That's a good question for Chris.
Some great warm-up poses are, I would say, of course, if it's available to you, before we do any significant type of movements, we really want to warm up our muscles and joints. And sometimes just very simple things of rotating your wrist gently, rotating those ankles. We did a lot of the point and flex. That's a great warm-up. You can also very gently, I am also a massage therapist, so I'm a big believer in warming up my muscles by doing gentle compressions. Again, all things that, you know, should be always referred to like a PT or a doctor if it's suitable for you. But yeah, joints and muscles should definitely be warmed up with lots of rotations. Yeah.
Linda says she was able to follow and complete all the exercises, which is a huge feat. So that's so awesome to hear that. I like doing these, you know, because we know for our patient community that exercise is so hard and can be so intimidating because you feel like you're never going to be able to do enough to make a difference. But even gentle, reclined, you know, seated exercises gets your body moving, gets your blood flowing. And that is a step in the right direction for all of us. And hopefully it's doable for most folks. Although we know that even this sort of gentle stuff can be hard for some people. Can Pilates exercises be altered for our community? Yes, we actually had a talk just yesterday or 2 days ago on occupational therapy as a treatment for dysautonomia by Emily Rich, who is an OT in Arizona, who actually works with Dr. Goodman at Mayo Clinic. And she said that she actually uses a lot of Pilates to treat her PUTS and EDS patients. So her video is actually just got posted to our Vimeo page today. She doesn't go into details on specific Pilates exercises, but maybe that's a good talk for the future we can ask her to do. So Elnora says, where can I get the books? So I actually don't know the names of the books, but I've seen them at the EDS conference. So I'm sure if you join any of the EDS support groups, or even if you ask on the Dysautonomia International support groups, because there's so many EDS patients in our groups, you say, hey, does anyone have any good books on physical therapy for EDS? There's a certain, I think it's called the Alexander method that quite a few of the patients seem to like. So that's something to maybe Google. Okay, well, I think we've got as much as we can, and we should probably let Chrissy go eat dinner at some point. And I know Dora will be asking for dinner pretty soon too. So
Always, that girl can eat all day long.
so thank you so much, everyone.
Thank you.
Kirsten,
Thanks,
for
Chris.
hosting and organizing.
Thank you guys, I really appreciate
No
it.
problem. It was so nice seeing or hearing from everyone. Christine, have a great weekend. Thank you so much.
You too, everybody stay well, keep moving.
Take care. Bye.
Bye.
Bye.